Good morning, everyone. I'm Dr. Abhinav Mohan, Trader in Department of Prosthodontics. So today I'm going to discuss on a small topic called shade selection in prosthodontics. As we all know, shade selection is one of the most important criteria or the factor that determines the outcome of a treatment as far as aesthetics is concerned. So let's see in brief the various shade selections, procedures, what are the factors that determine the shade of a particular object, and how to differentiate them. Yes, so in this picture, as we all know, it's Tom Cruise. This is how he looked like. So you can see the bad aesthetics, mismatched crown, a prosthesis in the front tooth area, and this is how he looks like now. So we can see the drastic change in the individual. You can see the confidence of smile. You can see the visibility of teeth. So many things. Everything has to blend harmoniously to achieve an aesthetic result. So let's see what are the factors that governs a smile. So we start with, there are basically 6 factors. So the first one being the size of the tooth, the shape of the tooth, the visibility of the tooth, and the midline, the incisal edges, and finally the shade. So it's not just a single entity that gives you a harmonious smile. So you need to have all these factors together, which governs a aesthetic appearance. So these are the various situations where a mismatch of shade, how bad it can affect the smile of an individual. Starting from the very first picture, through the entire thing, we can see how it can affect the aesthetics of an individual. So a shade selection, a proper shade selection of the adjacent tooth and the blending structures are very important as far as an outcome, a good aesthetic outcome is concerned. So this is just another video, an animation showing how the shade mismatch can create a difference. You can see the lateral incisor of the patient, the change in the shade. The darker it becomes, the more obvious it will be in an individual's appearance. Okay, so that's just an animation there. So now we move on to what is shade, because there are 2 things which we always talk hand in hand. We talk about shade and color. So what are they the same? Most of the time we interchange the terms shade as well as color. But according to Schellenberg, it's what is shade or color is a phenomenon of light or visual perception that permits the differentiation of otherwise identical objects. So you have teeth, you have both central incisors in the mouth. If you're going to replace one, so you have to have a qualitative analysis of the color of the adjacent tooth. So you always want to have a mimic the required color, which is almost blending with the adjacent tooth. So that is why the visual perception, what gives you that a particular color, is very important. So there are basically 3 entities that determines the shade of a tooth or an object. So they are the light source, the observer, that is the eye through which the perception happens, and finally the object itself. So these 3 things has to fall in place to receive an ideal shade. So now let's see one by one. So the first entity is the light source. As we all know, our eyes are able to see the visible electromagnetic spectrum. So this is the range. So this is what happens, the wavelength of your normal light. So when you're talking about a shade selection, we say the natural light at a time of around after 11 a.m. is considered to be the best for shade selection. Okay, so that is another tip. So you're going to do a shade selection when you want all this components of light to be present when you're doing a shade selection. That's the wavelength which we mentioned. This is the best time to do it. So let's say about 11 a.m. to 2 p.m. is the ideal time to do it. At dusk, we do have problems. We don't get all the components of light in that normal, it won't be present. So even if we use a fluorescent light or an incandescent light, that's what we normally see in a clinical setting, that is not sufficient enough to do or to achieve an ideal or a harmonious shade selection procedure. So are the other options other than this when we do? Yes, we do practice in the evening time. We need to have something called as color corrected light, so that the light source which is being used to observe the shade of an object contains all the required colors that or all the components of light present during a daytime. So these are available as lights or bulbs which can be attached to a light source of the dental unit or in the operating procedure room area, where you can use this light and select the ideal shade. So now what do you mean by color corrected light? So that is another thing. So just like we have the temperatures, okay, in kelvins it is mentioned. So the direct sunlight falls around 5,500 Kelvin temperature. A color corrected light has to be near to the range of 5,000 Kelvin. So when you see your LED light or a fluorescent light, the temperature is quite low compared to that of your direct sunlight or a color corrected light. So it is always preferred to have a temperature of your light around 5,000 Kelvin to do a shade selection. So how do you do it? We can attach it onto your chairs. You can do a track mounting, a ceiling mount, or a wall mount. Now you see the shade. This now next the light source. As we said, why do we have different type of light source available in our working area or in the clinic? So suppose this is what the single object looks like in three different shades or three different light sources. We talk about a molar being observed under an incandescent light, under a fluorescent light, and under a normal daylight or a color corrected light. So you can see the color corrected light gives you the ideal shade. But whereas when you see the same tooth being observed in the fluorescent light, it gives much of a yellowish green appearance, whereas an incandescent light gives you more of a dark brown or reddish appearance. So this is the same thing. So we call this entire phenomena as nothing. It's very simple. It's called as metamerism. That is the same object looking or like the same object being appearing in different colors under different light sources. So which light to select is the clinical tip which you would like to take from this. You need to always go for a daylight for your shade selection. Now we move on to the second entity, that is your observer, that is the eye of the person who is viewing that particular tooth or the person who is doing the shade selection. So same here, we know the eye, the rods and cones, the best perception of color happens at the center of the retina, which has got maximum cones. Cones are responsible for color vision. So that is why it is very important. So the operator's eye should be at the level of patient's teeth at a distance of around 25 to 33 centimeters. That's what the ideal distance is. And the operator during the shade selection procedure. So that is how the light can directly fall onto that required surface to give the maximum result or maximum perception of color for that particular object. So this is another graph, a representation of how the light source falls and how it is reflected and how the perception is made. So we have the reflection happening here, and we have not all light source goes into your eyes. Some will be scattered off and some will be even absorbed, as we know that. So, and the remaining light will be available for your perception. So the same concept can be utilized when you're doing a processes about the size of a tooth, making prominent or concave or convex surfaces, which gives altered appearance of the same object. So perception of length, you can have a different way of doing it. And same way, you can have a different way of altering the individual tooth line angles. So you get different way of making it either looking like more narrow or a widened tooth or a short tooth or even a long tooth with the same amount of dimension of that particular object. So now we see the adaptation of eye. So the eye has color adaptation. Normally our eyes get biased or the eyes get fatigued over a period of time when you stare at an object. So our color vision decreases rapidly on constant staring of an object. So what we always prefer to give as a tip is over a period of probably like 30 seconds or more, it's always advised to look at a far object or a far space of the sky, which is light blue in color, which gives you more relaxation for the eye for better perception of shade. So gazing for more than 5 seconds is not recommended when you're doing an aesthetic. Forget about the 30 seconds time frame, which we mentioned just now. Not more than 5 seconds with actually give you a better shade, because the more you look at it, the more different the tooth or the object might look like for you. So that is more important, the adaptation. We talk about the contrast. That is another thing, because most of the patients, whether the male or female patients, the contrast of that particular background is very important, because a darker contrast background will give anything, even though it is dark, it appears to be more lighter. So dark backgrounds has to be avoided. You have to ask a patient to avoid using lipstick, makeups, if they're wearing any tinted glasses or colored or dark colored clothes during shade selection appointment, because that could probably misguide you while doing a shade selection procedure. Now we move on to the object, that is the third entity, the tooth. So here the tooth or the object, the tooth shade basically consists of three components in color. That is, all of you basically know, we have discussed in your second year graduation level topics. You know what is hue, chroma, and value. So these are the three basic entities that are very important in determining a color for an object. So we start with hue. So hue is nothing. Hue is the basic component of color. So if we are talking about different, so if something is, some object is appearing blue, something is appearing green, or something is appearing red. So what do you say, red, blue, or green? So that is what, this is what is hue, the basic component, what the particular object is made of, or what the particular object appear as, or the perception for an individual for that particular object. So here you can see a sky can have all these colors. The sky, when you see the high upper horizon, you see the blue color. When you come down, you can see the color changes to light orange, yellow, or maybe even reddish. So that is, even when you see the objects of the buildings, it looks black. So that is a different color. The same sky, the same object has got different because of the light, the difference. And so maybe because of the clouds, this difference gives you at a particular level what the stage at this particular area, what is it looking like. Sky looks blue, the sky looks orange, the sky looks yellow, all those things. So this is what, so we can have either a red color, a green, a blue, or yellow. So this is what most of the time we see, and natural tooth fall in a range between yellow and yellow red. We don't have blue teeth. Okay, so we definitely have a range of between yellow and yellow red. We move on to the second component in the color, that is your chroma. Chroma is nothing. So how blue it is, you can see this is a lake, probably frozen lake. So when you see the water level and the sky here, you can see how blue is the water, how is the sky, all those things, the difference, the saturation. Okay, so you see the saturation of that particular thing, how intense is that particular color. That gives you the idea of chroma. So that is what is chroma. So it is defined as the saturation or intensity of the hue, the basic color. So you say the blue, the strong blue color, or a weak one. So you can see in the picture here, when you move on to the right side, you see a strong blue color. When you see the left, it is weak. The saturation is probably less. Okay. So now how does the effect of chroma makes a difference in the shape and contour? The less increased chroma will give a flat appearance, or depth, it shows increased depth. And decreased chroma will give a convex appearance or a prominence. So you less have the, if an object have less amount of saturation, it looks more prominent, whereas something which is more intense will have a less or less prominent surface. Now we move on to value. So value means it is the amount of brightness or brilliance of a particular color. So the relative lightness or darkness of the color is called as value. So how white? Is it very white, or it is light or medium or dark? So that's how we call it as high value, middle value, and low value for white. So that's basically, you need to know the value. Most of the advanced shade guides utilizes value as one of the primary component for establishing a proper shade while doing a shade selection procedure. So with that, we just discussed about the basic different types of the basics of shade selection. We discussed about the type of different components involved in color. We discussed about what the three entities what are responsible for an object to have a particular color. So next session, we'll discuss about the method of doing shade selection, as well as we'll see some takeaway tips on shade selection, and in detail about various shade selecting guides, as well as devices which have been used or which are available in the market. Thank you for the session.